We are thrilled tonight to have with us as our speaker today, Jennifer Pilcher, Dr. Jennifer Pilcher. Dr. Pilcher was awarded her doctoral degree in gerontology from the University of Massachusetts in Boston in 2005. Her professional experience has focused primarily on care and housing arrangements for elders with Alzheimer's disease and related dementias, including policy and fundraising work for the Alzheimer's Association of Eastern Massachusetts, the Alzheimer's Association of Utah, and the Massachusetts Association of Older Americans. Prior to funding Clear Guidance in 2018, Dr. Pilcher had a long career experience working with people with dementias and their families. For 7 years, Dr. Pilcher was affiliated with Hearthstone Alzheimer's Care Assisted Living programs in Massachusetts and in New York, where she held a number of management positions. For 8 years, Dr. Pilcher worked as both a care manager and as the director of operations for AZA Care Management of Boston, Massachusetts. In 2010, she joined Overlooked Care, a nonprofit care management practice in Greater Boston, as the clinical director. In 2016, Dr. Pilcher was promoted to the position of Senior Executive Director of Care Management and Private Care. In 2018, Dr. Pilcher founded Clear Guidance in order to return to her passion of working directly with clients and their families. She has also served as president of the New England Association of Aging Life Care and the editor-in-chief of the Journal of Aging Life Care. And most recently in 2022, she was the recipient of both the President's Award for Leadership and the Outstanding Chapter Member Award from the Aging Life Care Association. And again, we are thrilled to have you, Jennifer. And with that, the floor is yours.
Thank you. Thank you so much, Chris. Good evening, everyone. I'm so pleased to be here. Thank you to Judy and Chris and Barbara for welcoming me. I see some familiar faces and some new faces, so I'm glad to have you all here today. Chris, I'm going to go ahead and share my screen. Okay. All right, here we go. All right. So a lot of people ask me, how did I get into this line of work? And I think it's important for me to do that introduction of myself for you. This woman right here on this picture has been my inspiration. This is my grandmother, Caroline, who was diagnosed with young onset Alzheimer's disease in her late 50s. This is a picture of us together when I was about 2 before she was diagnosed. This is a picture taken shortly before she was diagnosed with her caregiver, my grandfather, David. This, unfortunately, is not a story of thoughtful and proactive care planning. This being the 1980s, the resources and supports were scarce. They fell victim to all the common pitfalls. They became isolated as family and friends did not know how to address her symptoms. They hired the housekeeper to become a caregiver who eventually stole some of the family belongings. David refused to place Caroline in a nursing home, so he carried her from room to room as their house could not accommodate a wheelchair. Unfortunately, he predeceased her in large part due to the stress of caregiving. Although this story is more than 30 years old, and there are much better resources and supports now, the themes and challenges remain the same. Unfortunately, many years later, my Aunt Joni was also diagnosed in her 50s. This is a picture of the two of us shortly after her diagnosis, and she passed away earlier this year. I tell you these stories so that you know this is not just a profession for me. I also join you as caregivers on this personal journey. I think Rosalind Carter said it first and said it best. There are only 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers. So we're all in this together, folks. I am hoping that what we discuss will be helpful for you going forward. I'm going to present a lot of information to you today, and I'm going to go through it relatively quickly because there are so many good nuggets I want to share with you. But please don't feel that you need to furiously write down the resources I present or the web links that I suggest. Judy assures me you're going to get a copy of my slides with all that information. So please just sit back and relax, and hopefully I can give you a few things to think about. A lot of people ask me in my profession, if there's little we can do to change the trajectory of the illness, why do we need to plan ahead? Why not just wait and see what happens? So these are some of the reasons that we want to be thinking ahead about what's coming and how we can possibly address all of these issues. And probably the most important of these is choice, right? We have more choice when we think ahead. We have more choice when we are proactive. But also having a plan, even if it's not specific to exactly what's going to happen, having information and having a plan helps you to feel more in control and that you have more choice as you go through this journey. Another important point is often the care partner, the way forward looks a lot like this picture, a vast landscape with a lot of different paths to choose, but being unclear which path to choose or why. Many people expect their neurologist to provide this pathway. The truth is, the role of the neurologist is to help diagnose, to identify possible drug trials, to decide on helpful medications, and to help track your progress over time. They're less equipped to help you plan ahead for care. Now, if you're on this call, I know you've already been connected to the Dementia Collaborative, which is a wonderful resource of people who can help you with some of these ideas. Tonight, I'm going to try and make this landscape a little bit less confusing by offering you some keys to success in care planning for people living with dementia. Perhaps the most important key to success is to be thoughtful about how the person living with dementia is going to spend their time. Many of the care partners I work with tell me that because the person with dementia has had to stop working or volunteering or engaging in other activities that they love, they spend most of their time watching television or in isolation. There is an abundance of data that points to isolation leading to depression, anxiety, and worsening of dementia symptoms. So avoiding this is crucial. It's important to point out that in order to avoid some of these negative outcomes, it is important for the activities a person engages in to be meaningful, and purposeful. It's not enough just to be busy. Many partners do not know how to create engagement that is meaningful. Here are some resources on this slide that I've offered here that might be helpful to you in getting started. This is a book, Creative Engagement, that I have read and shared with my staff that I like, that gives a lot of good ideas about how to do that. As well, there is a resource guide here that is offered by the Alzheimer's Society, which also gives some good ideas and can be accessed online. As well, one of my clients gave me a really good tip earlier this week about this website called Relish Life that also provides really good, ideas of things you can do to engage people in meaningful activity. Another meaningful part of interaction is socialization. This can sometimes be difficult to create in the home environment if you don't have a big social network or if that network has shrunk, which it has for some folks with this diagnosis. In this case, a day program might be appropriate and helpful. We're going to discuss later more about day programs in a few minutes and how you can find one in your local area. It's also possible to hire someone to provide this kind of engagement for the person living with dementia, which leads me to the next key to success, which is early introduction of non-familial supports. In my practice, I am constantly hearing from care partners that the person with dementia is stuck to their side like glue. I also hear that the person with dementia has a hard time accepting help from anyone outside of their spouse or adult children. And this is often uncharacteristic of who this person might have been earlier in life. For this reason, it's important to introduce the idea of spending time with someone outside of the family as early as you can. It is important for this engagement to be enjoyable, to be based on the interests of the person with dementia, and to be something they can agree to being part of. This will allow for the person who is living with dementia to develop a relationship with the person that is providing companionship. It is especially important to do this before personal care like bathing or dressing is needed, is that is an incredible intimate and personal way of helping that can be really intimidating to address with a stranger. The earlier you can introduce someone from outside the family, even if it is only for a few hours a week, the better success you will have later on in the process when more support is needed. There are some really challenging symptoms of dementia that are difficult even for the most experienced and patient care partners. If you are dealing with symptoms of dementia that are challenging, learn strategies for addressing them. In our practice, we talk about developing a tool belt for care partners. This tool belt needs to be filled with ideas and strategies for addressing issues and behaviors that are difficult. Those are your tools. It doesn't mean that the same tool will work every time, but you have a bunch of them on your belt so you can reach for different options if your first attempt at addressing something is not successful. Having strategies will help you feel more prepared to address these issues rather than feeling unsure in the moment they occur. Communicating with a person with dementia is not necessarily intuitive. I think a lot about many years ago when my daughter was diagnosed with anxiety. And I hired a professional consultant to come in and talk to me about how I should deal with this. And I have to say, the suggestions they made to me did not seem helpful or intuitive. I didn't feel that I was being caring or sympathetic with what they were suggesting. But in the long run, what they suggested to me was very helpful and eventually helped me to communicate with my daughter much more successfully than I had in the past. You are not supposed to know how to do this. Thankfully, there are a lot of good resources out there that can help. These are two recent books that have been published that I recommend. One is called The Dementia Concept by Josh Freitas, and the other is called The Complete Family Guide to Dementia by Dr. Brent Forrester of McLean Hospital here in Belmont, Massachusetts. Both are experts in the field, but come to this from very different perspectives. And I found the combination of their suggestions to be incredibly helpful. And I have recommended these books to many of my clients. Both of these books are available on Amazon as well. If your local library doesn't have them, you should request they purchase a copy. Both of these books will help walk you through ways to address difficult issues, symptoms, and behaviors. In addition to those two books, I also have listed here for you some YouTube videos that I have found particularly helpful. Disclaimer, one of them is me talking. So that's maybe why I find it so helpful, but it is me. And then I also have listed some education programs that are outside of what they offer at the Dementia Collaborative that you might look into that can help with learning about symptoms as well. As I said, it's a good sign you're here, you're already connected to a very good resource for education, but there's a lot out there you can take advantage of. Evaluating risk is another key to success in planning ahead. As a care partner, it is important that you are constantly doing risk assessment. What do I mean by risk assessment? It means assessing any behavior or change that could potentially put the person with dementia's safety at risk. In being a partner to someone with dementia, we know that it is impossible to eliminate all risk, nor would we want to, because that would eliminate a lot of the enjoyment that comes out of living your life. There is a certain amount of risk that is acceptable, and it is up to you how much risk you are willing to assume, to a point. At Clear Guidance, we talk about the line between risky behavior and dangerous behavior. The key is to identify something, an activity or a behavior, when it is risky, so you can address it before it becomes something that is truly dangerous. This can be very difficult to do as a care partner because you are so close to the situation. I like to talk about trying to get in the balcony so that you have a balcony view of looking at the situation that you're in. So this means rising above the situation and looking down on it objectively in order to evaluate what could be risky. If that's hard for you, and it's hard for most care partners, I encourage you to find someone at the Dementia Collaborative or at the Alzheimer's Association that can help you to take that balcony view and to look from that perspective so that you can get a true picture of the risk that you're taking and what you might do to minimize those risks. So what can we do to proactively think about risk and address risk? In order to be proactive, rather than simply reacting to these issues, we need to be on the lookout for what I call red flags. And at Clear Guidance, we do a lot of helping our clients identify what are the red flags that are specific to your situation. But I thought I might give you a list here of some of the things, the more typical red flags that we see caregivers running into that are warning signs that something else may be happening. And so here's a list of them. I'm going to read them and I'm going to talk with you about why this is important. So anything, any change. Now, I realize we're talking about a disease that has change as an inherent part of the disease. So I'm talking about sort of a more acute change or something that's really noticeable within a short period of time rather than something that develops over a long period of time. But you also want to look at the things that are occurring over a long period of time and how that may be more consistently raising the idea of risk for you. So we're looking for any change in safety awareness, right? What is safe, what isn't safe, and what's the understanding of what's safe in that moment. Any change in mood, sleeping pattern, behavior, ability to engage or relate to other people, those kinds of changes are really important to identify and look at. What could be causing this? And that's a good time to reach out to other people at the Dementia Collaborative or beyond to ask for help in how you might address that. Those books I mentioned to you will also be helpful in this regard. Any increase in agitation, irritation, anxiety, stress, resistance. These are important issues as well. That may be a sign that something is changing. It may be a sign that you need more support. It may be a sign that we need to do more to address anxiety and depression as side effects of these illnesses. We also really want to be on the lookout for any changes in vision or depth perception or other visuospatial issues. So often I will see when someone is struggling with something visual, they're having trouble telling the difference between, for example, a placemat and a fork that was placed on top of the placemat. And they're having trouble identifying where the fork is, or they're having trouble identifying how pieces of visual information go together, right? Depth perception is a big one. Are they having difficulty negotiating stairs or curbs or changes in flooring? These are all warning signs for you that your risk of falling and injury are going up. And so these are good places for you to be identifying and thinking about what's the intervention here that I can do to mitigate these risks. I could do a whole presentation just on this. So, maybe that'll be a sequel in the future where we'll talk about how do you go about addressing these things, but getting ahead of it is the really important thing, and knowing what you're looking for. What are those red flags that you're looking for? Oh, insurance, the most boring topic on the planet, but a critically important one for us to think about proactively. This is a key to success that most care partners often don't know to address. It's likely that at some point along the journey, you or the person living with dementia will need care in a rehabilitation facility. It's a fact of aging. It's important to know that some health insurance products will limit where you can get care, such as rehab. Most people aren't aware that having a Medicare Advantage plan or having a supplemental plan, such as Tufts, can limit where you can receive care. This is really important in the current environment. In the state of Massachusetts, we have a crisis in terms of the number of skilled nursing beds that are available, particularly in long-term care. And I'll talk about this a little bit more later on. We have had a series of facilities close through the pandemic. Every facility is experiencing staffing shortages. As well, the state has issued a bed reduction mandate. That means that there can only be 2 persons to a room in rehab and in long-term care going forward, in places where there used to be 3 or 4. So there's a huge reduction in the number of spaces available. In addition, there are 12 additional facilities with what are called intent to close hearings coming up in 2023. So making sure that you have the broadest band of options should you need this care should you need this care down the road is very, very important. For that reason, I want to make sure you have the most flexible insurance plan that will not limit these options. I've given you 2 resources here. The first resource is a free resource. So at every agency on aging across the state, what you typically know as elder services, there is something called a Shine Counselor. I've given you a link here that you can click on to find the Shine Counselor that is in your local area. And this is a free resource, you should take advantage of it, and you should go over with that person what your insurance is and how it matches up with your needs right now. In addition, I've also given you a Medicare advisor that I work for. She is fee for service, but she's really good and knows her stuff in terms of what you need with this diagnosis and insurance going forward. A key to success you have probably already had some advice about is legal and financial planning. Most neurologists will advise their patients to make sure they have up-to-date estate planning documents such as a will, power of attorney, and healthcare proxy. This is good advice. But to be truly proactive, you need to understand and appreciate why this is so important. The first reason it is so important is because at some point, you as the care partner will probably be in a position where you need to make decisions for your partner living with dementia. When this will happen for you is impossible to predict, but I want to talk about how and when this can happen. A person who is able to make their own decisions about their health knows the questions to ask of their healthcare provider, understands and accepts the possible consequences of that diagnosis, and can incorporate new information into a decision about treatment. Some people with dementia can maintain the ability to make decisions like this very late into the disease. For others, this will be something that is more difficult within a short period of time. Many people ask me, why is it so important to have these documents in place early on? There are a couple of reasons. After a certain amount of time has passed, a person with dementia may no longer be competent enough to sign these documents. So it's important to do it as early as you can. If you don't sign these documents and you have not identified ahead of time who your decision maker will be, and you lose the ability to make those decisions yourself, your family or other parties will have to file for guardianship for health decisions or conservatorship to manage finances. The person to serve as guardian or conservator will be assigned by the court and may or may not be the person living with dementia would have chosen. So, in order to maintain the most choice and control over who makes your decisions, it is vitally important to have these documents in place. In addition, it's important for the person who is assigned as the decision maker to be aware of the person living with dementia's preferences for care. It is very important that whenever possible, the wishes of the person living with dementia are honored. These conversations can be really difficult to have, especially after a diagnosis of dementia. Two fantastic and free websites that are helpful in having these discussions are Honoring Choices and 5 Wishes. I've given you here the links to those websites. These websites really walk through what are the tools you can use to have these conversations, what are the questions you should ask, and what are the things you should think about. And I find them to be a very helpful resource when addressing these very difficult issues. Along with legal documents, it's important for you to plan ahead about the cost of care in the future. Most people are surprised to find out that typical health insurance does not cover care. If you are over 60, you may be eligible for programs that can offer assistance with paying for home care and/or assisted living. If you are younger than 60, you may be able to apply for disability through Medicare, which can help with the cost of care as well. If you are not eligible for programs that are offered by the state right now, is there a way for you to qualify in the future? If you are going to pay privately, how long will that money last? And will you need to apply for Mass Health long-term care benefits in the future? I've included here a series of links to some of the programs. So the top 2 links are PACE and the Frail Elder program, which are 2 programs that are available to those who qualify by the state for help with the cost of care. As well, I have put the link for applying for Social Security disability. If you have not met with an elder law attorney or an estate planner, I have put the link here for the Massachusetts NALA, it's the Association of Elder Law Attorneys, on the bottom. And that's for Massachusetts. If you're outside Massachusetts, you can just go to NALA.com, not massnala.com, and you can find people that specialize in this area that can help talk you through what you might be eligible for, what you're not eligible for, and what you need to do to become eligible in the future if that's possible for you. And if not, what do you need to do to project forward about the cost of care? So I'm going to walk you through what is available out there for resources for care and what is the average cost. Just checking my time here. There's a lot to know and it's very confusing. Regardless of how you will fund care, it's important to learn ahead of time what the options are, when they are appropriate, and the potential cost. And again, all this information will be given to you after the presentation. This is just to give you a basic idea. I have laid it out for you here, the different kinds of assistance you can have at home, what that looks like, when it's appropriate, and what the approximate cost is. It's important to know that if you are paying for home care, if you're privately paying for home care, many of those resources require a 3 to 4 hour minimum at this point. So if that's what you're looking at introducing, knowing that that is an expectation is really important. There are a couple of places in the state of Massachusetts that will offer 1 to 2 hour minimums, but there aren't very many. This is hard because, as we've talked about before, introducing care early, introducing that relationship early is so important. How do you come up with something for them to do for 3 or 4 hours can be a real challenge. And so I would encourage you to look around and see if you can find an agency that is willing to do a 2 hour minimum. If not, it's time to get creative about what outings and what activities can take a little bit more time. Generally, we're talking about in the range of $30 to $35 an hour at this point for private pay home care. That's generally what the going rate is now. Some are a little higher, some are a little lower. If you choose to hire someone privately, please make sure you look into the rules about doing that, because if you are using somebody up to a certain amount of time per week, you need to look at how you deal with your taxes and how they get paid. Okay, so then there's also, if the person you're living with needs round-the-clock supervision, then you're sometimes in a situation where you need to pay hourly for 24 hours. In other situations, particularly if that person sleeps through the night or wakes up infrequently, you can have someone who would live with you as long as they were able to sleep at night, and that's less expensive than having someone there 24 hours a day. On the bottom of this slide, I put the link to the Home Care Alliance of Massachusetts, which will give you a way to search for agencies in your local area. If you're outside of Massachusetts, you can also use a resource I'm going to give you in a minute called the Community Resource Finder that can help you look in any state, but Home Care Alliance is specific to Massachusetts. There also are home care alliances in other states, so you can also find those. It's also possible for you to speak to a person like me or someone at the Dementia Collaborative or someone at the Alzheimer's Association to get a list of the people in your area that do this kind of work. So earlier we referenced day programs, and this is another way of having supervision, having socialization, and meaningful engagement. And I'm pleased to say that when I was giving talks a couple of years ago, I was talking about how all these places were closed because of the pandemic, but they're open. Many of them have opened back up. There have been some new ones that have opened, and it is really can be a fantastic way to spend your time. And I know a lot of my clients have had really good success with introducing this kind of support. On the bottom of the, so I've given you here an idea of what that costs and what it looks like. There is transportation for some of these programs. For others, there's an additional cost for transportation. Sometimes the VA will cover the cost of this if you or the person you're living with is a veteran. And often the hours are 9 to 3, but some have some extended hours later in the day if needed. On the bottom of the page is a link to the Community Resource Finder. This is something that is run by the Alzheimer's Association. And you can go to this link and you can search for resources like day programs or home care or people like me who are all listed on that website. So that gives you a place to go find those kinds of resources. Okay. To plan ahead and be proactive, you also need to get familiar with the types of residential options that are available should you need them. For some people, you will never need them. For other people, you will. It's important to know what's out there and what it looks like so you can be prepared. This slide sort of outlines for you what are the different levels of care that are available in the community and how do you know, and I'm going to talk about that next, when each is appropriate. So as you can see, I've sort of built a staircase here for you, which is trying to illustrate the point that as you need more help, you go further up the stairs with the highest level of assistance being provided in a skilled nursing environment. Now, I know some of you have probably heard the term CCRC or Continuing Care Retirement Community. This is a campus that has more than one, often 3 or 4 different levels of care in one place. That's what a continuing care retirement community is. Some of them require you, many of them require you to enter when you're independent, and then you can progress through the levels of care if and when you need them. Others will allow you to enter at different levels. So that's, I'm just going to mention that here. And the rest of the time, I'm going to talk about these different levels of care, but know that a CCRC or continuing care retirement community is one that includes many, if not all of these levels. So how do you know what level of care you might need? You know, you might know now, but even in the future, how will I know what's appropriate? And so I've given you some ideas of resources of people that might be able to help you. So if you end up in the hospital and or a rehab facility and you're trying to decide on where do we go from here, often the discharge planner, or sometimes they call them case managers, will be able to help you identify what's the level of care that is appropriate here. A facility as well, if you are in a rehab facility, often part of their discharge instructions or their discharge recommendations are around what the level of care is that you need. If that's not available, you can go to your aging access point, which is what ASAP stands for. So that's elder services that is in your local area. And you can Google what's the aging service access point in my town, and they will tell you who it is. There are people there that can help you evaluate this. If you're working and you have an employee assistance program as part of your benefits package, and if you're still working and you don't know if you have this, ask your employer, because they often can be a good resource, as well as sometimes they will pay for people like me to give you advice. So that's something to really look into. And then, of course, there are people like me, life care managers, who are out there that can help you determine this. Also, if you are looking at a particular place to live, if you're looking at a residential option and you're wondering, what level of care do I need to be at? When you choose a facility, they also are going to come and meet you and learn about you and give you their opinion as to what level of care is most appropriate. So there are lots of different places for you to seek out this information if you're unsure. Come on, slides. Here we go. All right, so I'm going to talk to you a little bit about what's available in residential housing and what's available in nursing care so that you can get a sense of what the difference is. So there's two parts of assisted living. There's traditional assisted living, which is really for persons who need help with personal care or need reminders or cues or safety checks. This works well for people with early memory loss or cognitive impairment, and can be very successful. They also will do medication reminders or management if that is appropriate. In addition to that, many assisted living facilities have something called a special care unit or a memory care unit as part of their continuum that is a secured place and is a place that provides 24-hour supervision and a lot more support, supervision, engagement, all of that. Whether one or the other is appropriate, again, is something you would need to talk through with that particular residents to find out what their expectations are, and also your thoughts about what's appropriate here. Obviously, the cost goes up the more assistance you need. As I was preparing for this presentation, I also realized I had to update my rates because things have gone up in the last couple of years. So this just gives you a general idea of cost. It's not, these facilities put together their packages very differently. Some are, there's one fee, it doesn't matter how much care you need, that's what you pay. Others have sort of what I like to call an a la carte menu you can add on to. So it can be very difficult to compare apples to apples. And again, this is a place where you might want to get some help or advice about how to compare the different options that you're looking at. The highest level of care, so if you're remembering those stairs I outlined for you, the highest level of care is care that takes place in a skilled nursing facility. There's two types of care that take place in a nursing facility. One is what we call skilled nursing or rehabilitation. This is short term, usually follows a hospitalization or an injury or an extended illness, and it's covered by Medicare most of the time. They will tell you, I know everybody knows this number, you have 100 days of rehab. Here's what I want you to hear. You have up to 100 days of rehab, but the determination of how many days you have is made by your insurance company and the rehab facility. It's your job when you're in a level of care like this to advocate if you feel you've not reached your potential for recovery for a longer stay. If you don't do that, they will tell you when to leave. You do have the right to appeal. So if you find yourself in this situation where you're in rehab and you're being told your insurance is going to end and you believe more time is necessary, you need to ask for an appeal and then ask for help about how to apply for it. The other type of care that takes place in skilled nursing is long-term care. Sometimes it becomes necessary to be taken care of in a skilled facility, because this is the only place where Medicaid will cover the entire cost of care. So sometimes for financial reasons, we are going to this kind of care. Other times, either living at home or in assisted living becomes really challenging. If the person needs more than one person to help them get up or transfer from chair to bed, bed to chair, that kind of thing, it can be really challenging to do that in the home environment or the assisted living environment. And so that's when this level of care can be appropriate. On the bottom of this slide, I've given you a link to something called Nursing Home Compare, which is a federally managed website that allows you to see the ratings. So every skilled nursing facility is inspected and surveyed every year. And they look at things like health, hygiene, cleanliness. They look at staffing. They look at feedback from people that live there. They look at things like, have they been cited for things like too many falls or over medicating people or using different kinds of equipment they're not supposed to use. And so the state gives every facility a rating every year. And you can go on this website and you can see what their rating is, and you can put in your zip code and you can look for the facilities in your area, what their ratings are. It also will tell you if there is ever been an allegation of abuse in that particular facility. It gives you a nice little red hand as a symbol to show you what are the ones that have had that kind of complaint against them. So it's one way that you can vet these facilities should you need them. One thing that's really important to mention at this point is that as I explained about the lack of spaces available, what was interesting in the pandemic is many people decided to leave facilities or decided not to take a residential or a nursing option at that point. Since the pandemic is not over, no matter who says that, but since we're in the recovery phase of the pandemic now, there's been a real boomerang. There's been a real shift back to real high demand for a lot of people for this kind of care. And so the wait lists are long. And so it's important that you look into these options, that you get yourself on a wait list, even if you're never going to use it or you hope you're never going to use it. When your name comes up on that wait list, they can give you a pass and circulate you back into the wait list. And you can just say, I'm not ready now, but you can stay on the wait list. Very, very important in this environment right now of scarcity of these good quality placements. So how do you find a facility? Well, things like Encyclopedia Britannica don't exist for this, unfortunately. And I'm encouraging you not to Google. Please remember that people who leave Google reviews are either really happy or really unhappy. The average person does not usually send a Google review, and they can be really misleading. They also can lead you to places that don't have memory care. And so you can go on a real, down a real hill of exploring things that aren't even options and wasting a lot of your time. I have given you 2 links here that I think are good places to start looking for assisted living, if that's something that you are interested in looking at. One is the Massachusetts Assisted Living Association, and the other is a website called New Lifestyles. Both have the ability to put in your zip code and to ask for certain features that you're looking for, and we'll give you a good search. I want to caution you about using places like A Place for Mom or Two Sisters or any of those kinds of placement agencies. If you have a very uncomplicated and streamlined situation, they can help to identify what's out there. But you need to do your homework on quality. You need to ask the facility to provide you with the names and contact information of people who are living there right now in that facility, of their care partners. So you can call and ask what their experience has been like. The problem with a lot of these search engines is that these placement folks is that they're getting fees, they're getting paid by the facilities that they refer to. So there has to be some inherent bias there that we have to be careful about. So yes, utilize them to help you figure out what's in your area and how, what places have memory care and all of that, but also take that additional step to make sure that you've identified this is a place that has worked for other people, and that you feel has good quality. Many people ask us at Clear Guidance, how do I decide between staying at home with care or going into a residential placement? How do I do this? And there really is no wrong answer. Sometimes there are situations because of symptoms that push you in one direction or the other, and you don't have as much choice as you'd like to have. But there is no judgment here. Sometimes it can be based on timing. Sometimes it can be based on social opportunities. There are many more social opportunities in a residential placement than there typically are at home. That could be really important for you. That could be less important for you. That could influence this decision. Finances might influence this decision. If you get to the point where you need 24-hour coverage at home, that can become really expensive. So it may be that looking at residential placement is a way to reduce some of that financial burden. So this is a very important question. It's an important question to reach out to those of us in the field to ask questions about, and to really think about not just what are the preferences that you're trying to live up to, but also what are you really able to do as a care partner? And that is not a judgment call on whether you're good at it or you're not good at it. It's important that you're mindful of your own stress, which is something we will go on to talk about a little bit. The most important thing is that you don't go it alone, and your organizational chart for your home does not look like this. This is not a good example of how to divide and conquer the work here. So, it's really important. I know Katie Brandt from the FTD unit at MGH, she likes to say, build your village. And I think this is a very good example of that. Find the resources in the community. I've given you a lot of ideas. Rely on the recommendations that your neurologist or your other provider might make of resources you can reach out to. Reach out to someone like me, reach out to people at Elder Services to help you think this through, so that you really have a team of people that are advising you and guiding you through this process. The fact is, one of the keys to success is managing stress. Having a team of people who can advise you is really important, because the data on care partner health and stress is not good. This is one of the studies that was done recently And in this example, 17% of caregivers reported their health was either fair or poor. This is 7 percentage points higher than the general population average. More importantly, 38% of caregivers reported feeling highly stressed due to caregiving responsibilities. This is a problem, right? And if you don't want to just rely on that study, here's some other information from the Alzheimer's Association. 59% of caregivers rate emotional stress as high or very high. Most caregivers for people with dementia suffer from depression. 74% of caregivers report being somewhat concerned or very concerned about their own health. So there are real reasons and impacts on your health that make it important for you to learn these resources early, learn as much as you can, and have a plan going forward so that you can feel more in control of this situation as you go forward. This is my final comment, and then we'll open up to questions that I'm sure you have. And we believe at Clear Guidance, if you are brave enough to live with dementia, or you are a partner to someone who is living with dementia, you are a superhero. But no superhero can do it alone. You need a team of sidekicks. So rely on those of us on this call, rely on the resources I have given you to start creating that village so that you can continue to be the superhero that is needed. All right.
All right, Jennifer, thank you so much.
Yeah. Should I stop sharing my screen, Chris? Would that be good at this?
Yeah, I think so. I guess for the Q&A, it would just be good if it was just us two. So we do have some questions down in the chat. We do have a little bit of time, so I'm going to try and see if we can get through all of them. Again, Jennifer, thank you so much. That was very informative, and it was wonderful as always to have you. So one of the first questions that I have here that I'm reading, Julie asked, do you have any tips or resources that might be helpful for the spouse of a patient or person with dementia who does not want to engage regarding the discussion about getting help? How can friends and family help them be more receptive?
Yes. This is always a big challenge, and something that we work on a lot at Clear Guidance. It's important to remember that one of the side effects, or one of the symptoms of dementia, can be apathy, right? So not being motivated to change anything, not wanting to really engage in anything. And so what is key to this is trying to figure out, what is the person with dementia's motivation to go along with what you're suggesting, right? So it's really important when you're introducing supports, and by the way, nobody wants help. So eliminate that word from your vocabulary. This person is going to help you. That's a loser from beginning to end. So what you want to really focus on is, what's the reason? What's the purpose for this person coming in? What are they going to do? And it has to be something that that person is motivated to accept. So, for example, let me give you a couple of examples. We're working recently with a very resistant client who really doesn't think she needs any help and doesn't see any reason why anyone should come in. But we were able to figure out through our research that she really loves dogs. And we have a caregiver who is training their dog to be a therapy dog, and they need to spend time walking and interacting with people. And so we've pitched that this person is going to come in to walk the dog together and to help socialize the dog. They take the dog to the dog park, they socialize the dog with other dogs. this is something that person can accept. Don't forget the power of I, person with dementia, am contributing to this. I'm helping. I'm part of this. I'm not the helpee, I'm the helper. How can you flip it so that it feels like something that's being done together? It is something that's being done together rather than something that's being done to help me because of my disability. Nobody wants that. So I think there's a couple of keys to it. One is uncovering what the motivation to accept is. And when I say accept, I don't mean jumping up and down with pom-poms. I mean going along with, right? Going along with is what we're looking for. And then also, what can you introduce that can feel to the person with dementia like they're contributing to it as well? If you've been dealing with someone who's really resistant, drop it for a little while and go back to it once you have a creative idea about what kind of interaction and what that person is going to be doing that is meaningful and makes sense. That's my advice on resistance.
Great, thank you. I think we here at the Dementia Care Collaborative, we often talk a lot about, going away from introducing, new people as, in an official capacity, and more about how we, how do we introduce or build a relationship, that is more organic. Um, and I think that, serves to preserve a lot of, a lot of times it goes a long way in terms of preserving the person with dementia's sense of self.
Right.
So. And sort of in that vein, there's another question, bit different. How do you introduce a day program or the concept of a day program to a person with dementia who doesn't think of themselves as being particularly impaired?
Yeah, it's a great question. Uh, First of all, I think you want to look for a program that has people that look similar to the person and are functioning similar to the person that you're caregiving for. I think that's important. Although it's not the end all be all, because all of these places are going to have mixed populations, and that's an important piece of this. Just is. It's a reality. I think you want to make sure when you're introducing it that you're talking about it either being an opportunity for a social event, right? Meeting other people and why that is so important. I talked earlier in the presentation about isolation and why that is so important that we are not isolated, because it leads to further depression and anxiety and symptoms. And so, that's one way to talk about it, as an opportunity to socialize with other people and to keep your mind active and your body active. Sometimes we have pitched, introduced this as somewhere that a person with dementia is going to volunteer. Many of these day programs are open to that idea of bringing someone in who's going to be a helper or a volunteer in that scenario. And that can sometimes ease the transition as well. So I think those are two ideas I have about how to introduce that. It is really important to be looking at what does that individual person, what is meaningful for them? Why would they feel like this was something worth engaging in, right? And I think that is something that requires a lot of customized approach, but addressing it as a social opportunity, and the importance of engaging in socialization, and then also the idea of volunteering is sometimes can be really helpful in these situations.
Thank you. All right. There's another question. Philip asks, is there any guidance available for how long someone may be in the category of needing 24-hour long-term care?
Okay, so is the question how long till they need 24-hour care, or how long will need 24-hour care?
I'm not sure.
Okay.
If I had to guess, and Philip, please feel free to clarify in the chat. If I had to guess, I think maybe the question is asking what are the signs that a person may need long-term care,
Okay.
um, or how long would a person typically be in that state?
Okay. I can answer both questions if that's helpful, and then we'll go from there. So the answer to the first one is, um, there are a variety of reasons medically you would need a skilled nursing environment. One of them, unfortunately, is if you can't manage your own diabetes. That often can be a reason why you need skilled nursing care as opposed to any other kind of residential care like assisted living. Right now in the state of Massachusetts, assisted living cannot handle diabetic care. It's a really unfortunate situation we're in, and I'm hoping it will change. I've been part of trying to advocate for that. But as of now, if you can't handle your own diabetic care and you need it done for you, you need to be in a skilled nursing facility. If you need an IV, a feeding tube, any sort of really complicated medical care, that can't occur in assisted living, that has to occur in a skilled nursing environment. If you need two people or more to help you get out of bed, get in and out of the shower, on and off the toilet, most of the time, that means that you need to move to a skilled nursing facility. Um, and then sometimes, as I mentioned before, it is the only place that is covered 100% by Medicaid. And so sometimes people move to those environments for financial reasons, because they need to use Mass Health or Medicaid to cover um, the care. So the second question about how long will someone be in 24-hour care is a really hard question to answer. And I know so many caregivers that come to me saying, why can't someone just tell me what the trajectory is here? And I can appreciate how hard that is not to have a solid answer to that question. I think um, what I've been told is most people have an average disease process of 9 to 10 years. Okay. Some people are longer, some people are shorter. Sometimes younger people, their process tends to be faster. Older people tend to be longer, but it depends. It depends what else is going on for you. What other medical complications do you have that might feed into this? What's your mobility like? All these different things factor into this decision. But if we're doing care well, right, if we're engaging people, if we are keeping people active in the early stages of this disease, what we really hope is that the amount of time they need to be in a skilled nursing facility or the amount of time they need around the clock care is the shorter end part of the illness, as opposed to the extent of the illness. I know lots of clients that go for years, being able to have intermittent supervision and not necessarily need 24-hour formal supervision. So it's a really hard question to answer, and I hope I've done some justice to it, knowing that it's a frustrating thing not to have a definitive answer to.
Yeah, I would say, us here when we, work with folks in one-on-one consults, I think that's probably the most common question we get asked is, essentially, what can I expect and when? And believe me when I say that it's equally as frustrating as providers not to be able to kind of give that clear answer into that and that clear roadmap, so to speak,
Yeah,
for exactly the reasons that you mentioned. Every disease is variable, person to person. There are so many different factors and things that can happen that can affect, the course of the disease process. So, as you said, it's very difficult, for us to be able to predict that.
right.
There was one clarification. Somebody mentioned that one of the questions earlier about, resistant to bringing care into the home, brought up that the person may have been asking more that the spouse of the person with dementia was resistant to in-home care rather
Mm,
than the patient themselves.
mhm.
Um, I
Yeah.
think this is particularly apt, particularly with, when I'm working with adult children of patients with dementia, where they're struggling because, not only may the patient be resistant, but the spouse may be as well.
Mhm,
Um,
mhm.
any recommendations or guidance?
Yep, and this is hard. I mean, when I said nobody likes to be helped, I meant that. No, nobody, and even the folks that are well can see this as a burden of having someone come into their home, and a lot of people don't feel particularly comfortable with that or don't feel it's necessary. So I think this is a tricky issue and something we deal with a lot at Clear Guidance, as I'm sure you guys do at the Dementia Collaborative as well. And I think the key to this is really to talk about caregiver wellness, and that this is a marathon, not a sprint. This is a long process. And in order for, the spouse to feel able to go the distance with all of this, it really is important to have supports, to have breaks from the role of care partner. And so I think talking about it from that perspective might be helpful as well. And also, one thing that has worked with some of our clients is to tell the well spouse, if you're the adult child, tell the spouse how important it is to you to spend time with that person individually. So, for example, if this were my parents, I might say to my mother, I know you're working really hard. I know you've got a lot going on. I would like to spend time with you alone. Would you be willing to introduce this so that the two of us, could go have coffee or have lunch? So giving something in exchange that's really meaningful, and you're asking, right? You're not saying you have to do this, because you're saying, I want to spend time with you. Would you agree to this so that you and I could have some time together? So that's one. Another one is to talk about the real issues of caregiver stress and needing to take breaks, and how important that is. I think also, just echoing what I said earlier in the presentation, if you can introduce someone as someone who's coming in to develop a relationship or do something that that person is interested in, and it can be in brief intervals, 1 to 2 hours, that will allow there to be a relationship that's outside of the family that will be helpful as you go forward. A lot of people think, well, I don't need anybody in here until I need help with a shower, or I need help with taking my pills, or whatever it is. And then it becomes that much more difficult to introduce it later on, when it's that kind of an intimate activity that somebody really needs help with. And so introducing it early, introducing it in short intervals with very clear purpose is another thing. So you're not, to the spouse that's well and doesn't want someone coming in and interfering, what are they comfortable accepting? Are they comfortable with someone coming in, taking their spouse for a walk or taking them out? Are they comfortable with having them do chores around the house? Some people are comfortable with that, some people aren't, right? What is it that they would feel comfortable with having some help with and assistance with? And that can help overcome some of that resistance.
Thank you. One question I had, um, just going over everything was, talking about a potential transition to a higher level of care, assisted living, skilled nursing, memory care unit, whatever the case may be. Do you have any recommendations about, what to be looking for, what questions to ask when somebody's in that sort of research process?
Yes. Um, and I've done presentations on just that thing. So yes, I do. I think right now, a really important thing to be looking at is staffing. It's probably the biggest issue we have in these environments right now. So the question is, what's your staffing ratio? How often does reality match up to what your staffing ratio is? So we're not just asking what's your preferred staffing ratio, we're asking how many people do you actually have on the floor every day? And what individual, so it's usually something like 1 to 7 or 1 to 6 in assisted living. In a nursing environment, it's more like 1 to 12. Okay. And, but what we're asking is, in addition to what's your staffing ratio, you also want to know how much time are the management staff spending on the floor? So the nurses, the program director, the activities director, the executive director, how much are they actually interacting and spending time? And how much are they in their offices planning things? That makes a big difference to the culture of a residential facility. The other thing you want to be asking about is how many of your staff are your employees and how many of them are brought in by agencies. So a lot of these facilities now, because of the shortages, are having to subcontract people from agencies to come in to fill the shifts. So that means these are not people that are under the direct supervision, training, and all of that of the actual facility. That's a sign that this is not a place you want to be. You want to be somewhere that has consistent staff over time. And I think knowing how long the management staff has been in place, you also want to be looking at, I'm giving you like the top three because there's a lot of things. The second thing is, how does the staff interact with the residents? So are they getting down on eye level? Are they making connections individually with people? Are they using things like touch to communicate? Are they really asking questions and being involved in that person's life? If you walk through a facility, you don't see anybody, there's nothing going on, that's not a good sign. There should be something going on, unless you're there in that 15 minutes where they're changing from one thing to the other. If you see staff sitting down on their phones, that's not a good sign, right? So you're really looking for what's the interaction between the staff and the residents in the facility. And that could be during an activity that's taking place, that could be during a meal that's taking place. It's any kind of way that they're working together, right? Or it could be one-on-one, sort of assisting somebody. That's the second thing. And I had one more. What was it? Oh, remember that you're being toured by the salesperson. So you're going to be given the community liaison for these facilities. That is the salesperson. You need to meet the people that run the show. You need to meet the resident care director. You need to meet the program director or the activities director. You need to meet the executive director. And you need to ask them the same questions that you ask the salesperson to make sure that you're all on the same page. And you're getting consistent answers across the board. That salesperson, the minute you move in, they disappear. You don't see them again. And it really doesn't matter how beautiful the facility is. It really doesn't matter how good the salesperson is. What matters is what happens after you move in. So that's the kind of thing you want to be looking for. There's also, if you go to the Alzheimer's Association site, they have a list of questions you should ask when touring an assisted living facility that you can find. I wish I had thought of that for this presentation. I'll try to include it, Judy, on what I send you after the presentation. But they have a list of things you want to look for and things you want to think about.
Thank you so much. So we're almost at time. There are two questions I want to try to get to if we
Sure.
can.
Yeah.
The first is Karen mentions that, I have to say I'm overwhelmed by the price of a special memory unit. Who has this type of money at $12,000 per month? It is surely scary that people would run out of money, and then what happens? I think that's a
Yeah,
fair question to ask.
very fair. So, and this is a really good reason to start exploring these issues with an elder law attorney as soon as you can, because you want to sort of map this out. There are some programs that supplement the cost of a special care unit in assisted living. And so you would want to investigate whether you are eligible for those programs. One is called group adult foster care. The other one is called um, PACE, which is something I mentioned earlier. And these are, but they only exist in certain facilities. There are also other facilities that have more affordable models that you can look into. So, and there's another program called SCO, Senior Care Options. All of these are programs that can help supplement the cost. It doesn't pay for all of it, but it can pay for some of it. And so that's important, and you need to apply for those, and an elder law attorney can walk you through how to do that. So that's important to investigate. And it may be that you have to, like something like PACE, you have to pay privately for a year, and then you can apply for PACE. So you want to plan for that as well. So I think that the last piece of it is, what do you do when you run out of money? So often we're working with families who have a finite amount of money. Most people do. They don't just have endless amounts of money. And so you have to have a plan around that. And so, generally what we're doing is looking at how long can we live in assisted living, if that's your choice, or how long can we pay for home care? And then what do we do after that? And at what point do we need to apply for Mass Health and then find a nursing facility, which is where Mass Health can pay for you to live? So often that's what we're doing with families, is planning for running out of money and what will happen when we do that, either from home or from an assisted living environment. And again, that's something an elder law attorney can help you with.
Right. So I'm going to try. I think we have enough time for one last question.
Cool.
This is a bit of a long one, so I'm going to try to condense this.
Okay.
Um, if one begins with occasional hired caregiving, how hard is it to find a caregiver that you feel good about, that you trust to be alone with your loved one? I guess, what are some of the qualifications that you look for in a good caregiver?
Mm,
Um, and what would you say is, the bare minimum to look for?
mm,
Um,
Great question. Yeah. Um, so I think there's a couple of things. Experience is important. Knowing that this person has had the training in dementia care is really essential. Not everyone has had training just because they are a home health aide, a certified home health aide, or a certified nurse's aide. There is a very good training, and now I'm going to forget what it's called. It's called CDP, Certified Dementia Practitioner. And you can get this training online. A lot of facilities offer this, a lot of home care agencies offer this to their folks. And so if you can find someone that's had that training, you can feel relatively confident that this person has a solid understanding of working with people with dementia. I would also want to know what, if they're working for an agency, what training has that agency provided them? Have they worked with other people with dementia, and what was that like? I think it's important to give caregivers a scenario. Here's something that I am experiencing. What would be your approach to this scenario? How would you handle this if this happened? And you're looking for those instincts, right? You're also looking for someone who's engaging. They're engaging in their conversation. If you, have somebody who has dementia that's really quiet and they like to sit quietly a lot of the time, making sure that you're not hiring a caregiver that's going to talk their ear off is really important. So it's personality and poise, right? If it's someone who has less experience, one of the things I always try to get to, and I do this in hiring too, is to ask that person to describe a really challenging situation where at first they failed and then they had to figure out how to succeed. And I find that that kind of a question can really tell you a lot about a person and their resourcefulness and their approach to solving problems. And really, there's a lot of dementia care that is about solving problems and reacting to things and figuring out what to do instinctually. So I think those are some ideas of what you're looking for, the kind of training you're looking for, the kind of person you're looking for, and then get references. Call people that have worked with that person before and ask what they're like and what it's like to work with them.
Great advice. Thank you very much. We are just on time. Managed to squeak in that last one without going too far over, so that's fantastic. If anybody's interested in working with you and your team, how can they find you?
Yes. You can find us at www.clearguidance.org.
Great.
You're
Yeah, and we're
welcome.
happy to, share that information as well for anybody who's interested. Um, and with that, that is all that we have for tonight. So I would want to thank everybody for joining us today. I want to thank Jennifer. Thank you very much for the wonderful presentation and all the great information you've shared with us tonight. And on behalf of the Dementia Care Collaborative, I hope everybody has a wonderful rest of their evening and have a great night.